If you had a recent C-section and are frustrated with your constant low back pain, feeling tightness around the scar, and just having difficulty moving around, this video is for you. In today's video, I am sharing 5 simple postural tips that you can implement right away, and you will start noticing a big difference in how you move, how you feel, and have a faster postpartum recovery. Hi mamas, and welcome back to my channel. If you're new here, hi, my name is Shridi and I'm a board certified physical therapist helping postpartum moms just like you regain their strength, heal their pelvic floor, and feel energized all in 15 minutes a day. So let's dive into today's video. So now before we talk about the 5 postural fixes, let's understand what the C-section surgery actually does to your body. And it is way more than just affecting your core and the belly area. After a C-section surgery, you will notice a difference in how you stand, sit, move, even your breathing. Add in unlimited hours of feeding, diaper changes, bending over to pick up your little one from the crib. All of these put together can definitely affect your low back muscles, causing that nagging back pain, but it also affects your hip and pelvic alignment, which can then cause constant weakness in the pelvic floor, low back pain. So understanding how your posture affects these muscles and how you can start changing the way you move in your day-to-day life is going to be a game changer. These small changes is going to make a big difference in how you feel and move throughout the day. So let's dive into the 5 postural fixes. So the first one, which is super common, and I'm guilty of that too, is shifting your weight on one side when you are standing. Think about having your little one on one hip and you're trying to cook, or maybe you're trying to put your little one to sleep and you're rocking her or him in your arms. During those movements, you will shift the weight on one hip because that's going to be more comfortable for you and you can stand longer in that position. However, what this does is it puts too much pressure on this hip and this side of your low back muscles. It also causes your pelvis to tilt, so now your pelvic floor gets off alignment. So now when you're trying to work out, you're trying to do exercises, you're eating healthy, you're doing everything right, but you're not noticing that your C-section recovery is making progress, it's because of this simple thing that you do every single day. So let's fix that. What you want to do is stand with your hips wider, your feet wider than the hips width so you have more support, and then try to hold your little one in front of the chest instead of one hip. Now if you have to put on hip, try to do more weight shifting instead of just standing on one side for too long. If you're cooking and have the little one on one hip, use a baby wrap to have it more centered. That way you can keep your spine and hips in straight line. This will reduce the pressure from the low back muscles and your core, but it will also help your pelvic floor muscles. And you will start noticing that your low back pain is getting reduced. Your core and pelvic floor are able to actually get stronger quickly because we're not putting so much stress on them. So that is the first one. Stop shifting weight on one hip and start being more centered when you are standing. Now moving on to your next one, which is you want to start squatting instead of bending. You probably have heard this a million times. But now when we are bending forward, you have toys around you tidying up. You want to empty your dishwasher. So every time you lean forward, if you're leaning at the waist, you're using those low back and core muscles a lot more. And now when we stand up, we have to again use those muscles to pull yourself up against gravity. So every time you bend at the waist and straighten up, we're putting so much stress on the core and low back muscles. Now, if you had a C-section surgery, your core is super weak. This is the area which is super tender. Now, if you're constantly bending at the waist, you're constantly activating your core muscles to help you lift up. But instead, if we start squatting, so think about sitting down in a chair where you bend those knees and then we pick up an object. We're using the knee muscles to push yourself up instead of your core and the low back. So this way you're protecting your core every time you squat. Now this is a habit you'll have to work through because in the first instance, you'll just want to bend forward because that's what you're used to. But making it a habit, every time you catch yourself that you bend over, repeat that movement, but do a squat this time. And this can be as simple as you're picking up a toy from the floor. If you catch yourself that, oh, I bent over this time, redo the movement and squat, because the more you practice, then it's going to get natural, because otherwise you'll keep bending and you'll keep straining your core muscles. So number 2 was start squatting instead of bending. Now number 3 is lifting objects closer to your chest. This can be your baby, but this can also be anything, car seats, strollers pushing, picking up the toys, you're putting away the dishes. So what this means is every time we're squatting, that's number 1, but now once we're squatting and we get the object, you want it closer to your chest and then lift up. So I don't want you to do a movement where you are like this and lifting up. So the further it is, it puts more strain on your core. But the closer it is to your chest, it's easier for your core muscles to help you lift up straighter. So the goal here is to keep the objects closer to your chest instead of too far. And then always brace. What it means is take a deep breath before you lift up. I know you are in a rush, you're trying to get things done, and it is hard for you to think about this, but the more you make it a habit to take deep breaths every time you try to lift your little one from the crib, it is going to get easier on your core muscles, and you will notice that your C-section recovery gets faster because you're taking care of these small things. It is going to take a time, and it's going to be a lot of practice before this becomes naturally. But whenever you think about it, oh, I need to take a deep breath before I lift the baby up, the more you practice, the more naturally it will come into your routine. So number 3 is always pick objects closer to your chest instead of having it too far and then bringing it up. So once you're at the level, we want to make sure it is close before we get up straight. That's number 3. Now moving on to number 4 is your seated posture. So you spend a lot of time sitting with your little one. This can be during tummy time. So you're sitting on the floor, you're feeding constantly, waking up at night and trying to put the baby to sleep. So you're rocking, sitting in the chair or your bed. So anytime you think about sitting, if you're not sitting supported, you're going to keep leaning forward like this. So you'll round your shoulders, curve your spine, and you're hunched over. So every time you sit, I want you to sit with back supported. If you're on the floor, back up to a wall where you can sit with support so your spine is nice and straight. What this does is it not only improves your spinal alignment and posture in the upper back, but it also reduces strain on your core muscles. Because when you are like this, you tilt your pelvis, which starts putting more stress on the core. But every time we sit up nice and straight with the back supported, your back is leaning against the wall. So wall does the work, or if you're sitting in a chair, the back support of a chair does the work to support your upper body. That way the core is not working hard to keep you sitting in an upright position. So during the first few months of C-section recovery, it is very important to always take back support. Don't try to push yourself and be like, oh, I can sit without support. This is not the time to push yourself and try to do more things. This is the time you have to support your body so it can heal and recover faster. So the 4th posture fix was always sit supported, either back up to a wall, or if you're sitting in a chair, scoot all the way back where your back is leaning against the backrest. Now moving on to number 5, and our last one is using a log roll to get out of bed, or if you're laying down when you sit up. What this means is always go on your side before you lay flat. So we roll onto your side and then we roll onto our back. We never want to do a crunch like this. Even if you're short in time, you're trying to run to get your baby up, always remember to roll onto your side, whether you are going back in the bed or trying to get out of bed. Always roll onto the side and then sit up. Every time you try to do a crunch, you put so much stress on those low back muscles, your core muscles, that it is going to slow down your healing process. Every time we strain those muscles, we take a few days off of the recovery. So keeping in mind these small things is not only going to speed up your recovery, but it's also going to impact how you feel throughout the day. You'll have less back pain, you'll be able to move better, more flexibility, and overall you'll feel better about yourself because you're not constantly dealing with tightness and back pain. So let's recap the 5 postural fixes. The first one is you're not going to lean on one hip, but you'll stand more centered. Second one is you will not bend at the waist, but you'll squat down to pick up objects or get your little one out of the crib. Third one is you will pick up objects closer to the chest and take a deep breath before lifting anything up. Fourth one is you'll always sit with your back supported. And then fifth one is you'll practice a log roll, which means going on your side and then getting up or go back down. You will not do crunches. So there you have it, 5 simple postural fixes which are super easy to do and implement, which is not only going to help you have you stand, sit, move, but it is going to make you feel better throughout your day. So go ahead and save this video, that way you can implement these every single day. Start with one postural fix, master that, and then move on to your next one. If this helped you, go ahead and hit that subscribe button below so you never miss a postpartum tip from me. I'll see you next week. Bye.